There was an article on November 12th in the USA Today about heart-stopping sex. The question is, how much risk are you at for dying from a heart attack during sex? Believe it or not, they've studied it. We'll talk about what they said in just a minute. But first, a brief introduction. Dr. Ford Brewer with PrevMed, heart attack, stroke, cancer, disability, dementia prevention. We're about preventive medicine. There's good treatments for at least some of these things, like an MI, but not so much for the others. And why don't we prevent all these things in the first place? So this was actually coverage of an article that was published, I think, on the 11th in the Journal of the American College of Cardiology. And that article was titled, Sexual Activity as a Trigger for Sudden Cardiac Death. Now, the article starts off with some introduction, and basically, one of the first points they make is, no, sex is not without risk. Pardon the sarcasm here, but I can't help reacting to that. I think most of us understand that, especially in some situations, sex is not without risk. But that I won't go any further on that. They quoted an article on a German autopsy study. They did autopsies of natural deaths and found 0.2% associated with sudden cardiac arrest. Speaking of sudden cardiac arrest, they went on to differentiate sudden cardiac arrest versus MI, myocardial infarction. I think it's worth clarifying that for a minute. Most people hear heart attack, and that's what they think. But cardiac arrest is very different from heart attack, and these next two slides will show you the difference. Heart attack is basically where one of the arteries gets clogged, and you have damage to the muscle beyond that artery. Coronary arrest is an electrical problem, and the heart stops beating or gets into a very disorganized beat. Again, I see that's fairly difficult to see. Here's some differentiators here. Does the person have a pulse? If he's got a pulse, it was a heart attack, it was an MI. With sudden cardiac arrest, no pulse. Is the person breathing? Yes, again, that's not going to be a sudden cardiac arrest. Can the person respond? If yes, again, that's not a sudden cardiac arrest, like V Fib. Sudden cardiac arrest, ventricular fibrillation, that's what you see on the TV when they come running up with the defibrillator and shock the patient. Again, this, I think, makes the statement fairly clearly. This is a gentleman having an MI. Again, potentially losing part of his muscle tissue for the heart due to blockage in an artery. And this one has sudden cardiac arrest. Again, a problem with the electrical function of the heart. Now, one other thing to note, one of the most, if not the most common cause of sudden cardiac arrest is a heart attack, a myocardial infarction. So there are two reasons that a myocardial infarction can be very, very serious. One is it can blow out a part of your, or damage a major part of your heart muscle, in other words, leaving a weaker pump. But the other thing is it often causes these electrical defibrillations. I believe it's up to maybe a third or a half of MIs actually present with sudden cardiac arrest. It's a large number. Sorry, I don't remember the number. I'll have to look it up and put it in another video. So what was this article about? It was about the Oregon Sudden Unexpected Death Study. It's a registry that's been going on since 2002. They studied all cases from 2002 to 2015, all subjects greater than 18 years old. There was a total of 4,557 sudden cardiac arrests. The mean age was 62 and a half years. And one of the questions that came up to me was, How did they know that this was related, this sudden cardiac arrest was related to sex? Well, they dealt with that issue. They basically said the histories were taken from EMS reports, and 99% of these reports were detailed enough for them to determine whether or not it was related to sex. Out of those 4,000, how many cases were related to sex? 34. So that's 0.7 of 1%. Less than 1%. Actually, if you, they did it a couple of different ways. Another statistic that they pulled around it was out of 100,000 life years, in other words, 100,000 adults living life for a year, there were approximately 28. So here was the quote from the author. The author said this: "The findings are reassuring," meaning for people with heart disease concerned about the risk of sex and heart attack. Now we can tell them the risk is very low. And the name of the author was Sumit Shug. I think I'm pronouncing that last name correctly. He's a cardiologist at Cedars-Sinai. Now, what do you think? Do you agree with Dr. Shug that that's a very low risk? Frankly, I do. And again, you can't help some of the sarcastic jokes around this. I think many people would say it's clearly worth the risk. And again, a bunch of other levity around it. However, the reality is that is a good piece of information to know, because that is a concern that a lot of people bring to the bedroom. What are your thoughts? Again, I started to ask, what are your experiences? Maybe not for YouTube. Thank you again for your attention.